We're continuing to follow the latest numbers from health officials as flu cases across Ohio continue to surge. Hospitalizations have jumped from 745 to over 1,400 in the last week alone. In Cuyahoga County, the most recent data shows ER visits are at 479. That's up from 440 the year prior. Health experts say they are seeing more complications from the flu in children.
So we're seeing kids with bacterial pneumonia, kids needing chest tubes. But right now, being in the trenches, it definitely feels bad. Like it just feels like there's a lot.
While many have dubbed it the super flu. So to find out what makes this year's season so different and what can we do about it, let's go to senior health correspondent Monica Robbins over at Studio B, because you have a person that has the answers.
Yeah, I do actually. Yeah, this is becoming one of the worst flu seasons we've seen in a very long time, and a new variant is pushing this spread. And to learn more about what we're dealing with and what we need to do about it is Dr. Joseph Khabbaza, a critical care pulmonologist at Cleveland Clinic. Thank you so much for being here.
Thanks for having me.
Everybody's on the edge of their seat. They want to know, first of all, let's talk about this super flu thing that they're calling it now. Is this flu different from other flus we've seen in the past?
I think what really makes this flu different, that's getting all the attention and label, is that it's kind of mismatched and not as protected with the vaccine that we have going on. And it just seems to be more contagious than other flus we've had in the past. So that combination of more contagious and not as much protection, at least from infection with the current vaccine, it's getting a lot of attention, and deservedly so. Probably about over 90% of our flu A isolates, or even more, are this H3N2 subtype or subclade K, while there's a small percentage of the other influenza A as well as influenza B right now.
So, you know, we know vaccination rates right now are hovering at 40%, which is typically kind of low, and if not less, and a lot of people are hesitant to get vaccinated. Does it make a difference if they do so now?
So getting vaccinated now still can help you in this flu season. I don't think we're anywhere near our peak, but it's not going to help you within the next 2 weeks. You know, it's going to take about a couple of weeks for the immune system to kind of build up the defenses and the army specific to the vaccine when you get it. But after those 2 weeks, there's still going to be a lot of flu in late January, February, and even tailing into March. So there still is a lot of protection that can be obtained. And even with the mismatch, I think a lot of patients are asking me, well, because of this mismatch and not having protection against this new variant, does that mean the vaccine is not effective? It means it's just not as effective at preventing infection altogether, but definitely when we look at studies from the UK and other countries, there are signals that suggest it's going to help keep people out of hospitals or at least minimize the severity of illness, and that's really extremely important.
Because vaccines aren't going to stop you from getting exposed or getting sick, but they're going to teach your body how to fight it, right?
So vaccines help your immune system recognize the virus quicker, right? So if an immune system that's not efficient, that's not able to recognize the virus quickly, it's going to take time to build up the defenses, and that's more time for the immune system or for the virus to be able to cause inflammation and damage in the body. And then later on, an inefficient, dysregulated immune response, less targeted, will occur, and that can bring on a lot of inflammation in addition to the damage the virus is doing. So people can be very sick the later the immune system recognizes specifics about the type of invader it has to fight.
A lot of people are telling me they're getting sick, then they get better, then they get sick again. What is that? Is that common with this type of flu?
So that's a classic thing we see really across all viruses, especially respiratory viruses. Now, what's unique about our respiratory tract, it's kind of open to our environment. And from the tip of our nose down to our last air sac, we have thousands of bacteria hanging out in our airways. They're pretty benign. They're part of our normal airway bacteria. But when we're infected with a respiratory virus, there's a lot of inflammation, and those barriers can be disrupted of the lining of our airways. And so we can get better from the virus and start feeling better, but some bacteria from our airways will start creeping into some of those cracks in our surfaces, and that can cause deeper infections and bacterial pneumonias, bacterial sinus infections, and that's when people start feeling worse. And that's when earlier antibiotics will be very important to prevent serious complications.
Is Tamiflu working on this one?
Yeah, so Tamiflu is going to help with really any influenza virus, but the thing with Tamiflu is that it's got to be taken, the earlier it's taken, the better it's going to be. That first 48 hours really can be the most helpful in minimizing viral replication, which then will minimize the amount of work your immune system has to do, the minimize duration of symptoms, minimize severity, minimize how infectious you might be. But getting it earlier, that's the most important part, and a lot of times people will check later.
We're just about out of time, but quickly, where are flu cases in the hospital that you've seen? Are we seeing them go up? Are we seeing them steady? Where are they?
Yeah, flu cases are continuing to go up each week. I've been in the hospital just before Christmas, the week of New Year's, and it's getting more and more. So our emergency departments are filled throughout the Cleveland Clinic system, patients boarding in the emergency department. Our floors are filled with flu patients predominantly, and the ICUs are now seeing a lot of activity of people with respiratory failure related to flu and complications.
Okay, thank you so much, Dr. Khabbaza. So there you go. Take it seriously, and of course, I'm going to go back to wash your hands, wash your hands, wash your hands.
Yes, always wash your hands. Great information on that, Monica. Thank you so much. Matt, we were listening intently, I know that.
Yeah, all of us for sure. I mean, everyone's dealing with this here in Northeast Ohio. There have been lines around pharmacies for that Tamiflu. You can't get it. You know, a lot of people have either had the flu or are dealing with that now. Another little tip from your local meteorologist, I swear by humidifiers. When you have the dry air this time of year, you get those cracks in your nose and all that. That lets the flu and viruses go in. If you can keep the humidity up in your home between 40 and 60%, well, like 40 and 50%, typically good, then I tell you, it'll mitigate a lot of those chances for getting sick. And it keeps your skin nice and moist too versus that dry, cracked skin you have. All right, I'm not endorsed by a humidifier company, by the way.